I have to actually click out of this, so I'm not going to be able to see. So I'm just going to ask that I press next screen. Of course, the printer wasn't working today, and all the things that could go right and didn't. So bear with me. Thank you. All right. Yes. All right. So I'm just going to start. Good afternoon, everyone. We're excited to be here today with you to tell you a story of a drum making research retreat that involved a blizzard, a power outage, and the help of our participants pushing a vehicle up the hill, a case of the hives that I got, and many lessons that will be helpful in regards to community-based research and healthcare systems overall. Before we get into the details, I'll introduce myself. My name is Jasmin Cotnam, and I'll be presenting along with Elder Linda Barkman, who's on the call, and she'll be speaking in a few moments, and of course, Angela Underhill, who is a PhD candidate and working at Women's College Research Institute. We're here today presenting on a drum making retreat that we co-facilitated on behalf of our study team, Strong Bear Women's Journey. And we'd also like to acknowledge the traditional territory of the Anishinaabe people of Fort William First Nation, as well as the Métis Nation, where this research took place. And I want to recognize and just acknowledge that we are all treaty people under the Robinson Superior Treaty of 1850. Next slide, please. Okay, I'm going to ask Elder Linda Barkman to open us up in a good way. If I can find her. Linda, can you hear us? Oh, goodness.
I think her sound is turned off.
Linda, you might be on mute. You may need to go to the bottom of the screen and click on the mic button, which will then open it up. Well, when all else fails, we improvise, and I'm going to call Linda and just play it. How's that sound? Hi, Linda. That's okay. So I've got you on my phone, on speakerphone, so we can go from there. This is me making it work. Okay. So yeah, and then I'll just hang up and we'll go from there. I'll call you back when you want to talk again. How's that sound?
Okay, I'll try to figure this thing out.
Okay. Can everybody hear Linda? Just one nod from somebody. Okay. Okay. There we go.
The hold is really up high. Sorry about that. I'm trying to, yeah. I don't have my technician beside me.
You mean me?
Yeah. It's beautiful out there. Oh my gosh. Everybody's just walking around. I went for lunch today to the Dew. And everybody's just having lunch outside in the sunshine, and it's beautiful. Smudging everybody. Hello, everybody. Creator, miigwech for getting us all together in this way, even though it's not the normal way, but it's normal enough now for us. But miigwech for everybody for showing up. Creator, give us the voices, give us the ears to hear what we need to hear, give us the heart we all have, that we know that we have so much that we just want to give it away to the people that we know who can use it and spread it around. Be rich, creative. Be rich.
Make works, Linda. I'm going to hang up now, and then we'll proceed on to the next slide. Thank you, Linda. That was really, really lovely. Okay, here's for making it work. Okay. Okay. So we're gonna start off with Strong Bear Women's Journey. Before we can talk about the Northern Sharing Circles and Retreat, we need to acknowledge that this project we are presenting on is just one of a larger initiative known as Strong Bear Women's Journey, which was previously known as the Aboriginal Women's Research Initiative, or AWRI. After several formative years as AWRI, with importance of Indigenous community research assisted led work in the forms of local sharing circles, AWRI held its first in-person retreat with team members in 2015. The team included Indigenous community research associates, Indigenous elders, members from community-based organizations who work with and for Indigenous communities, clinicians, and researchers. The purpose of the retreat was to share and learn what issues face Indigenous women living with and affected by HIV in their home communities, and to paint a national picture of collaborative HIV research specific to Indigenous women. Regional profiles of HIV and related issues among Indigenous women in Saskatchewan, Manitoba, and Ontario were also presented on. It was at this retreat that Elder Manish Shakabi, who's featured in this slide here, renamed our group Strong Bear Women's Journey. Many spent some time. She's also an artist and a wonderful woman, and was initially the elder for this project. She had some competing priorities and was focusing her work elsewhere, which we're very lucky to have Linda join us. But Minnie worked on this beautiful logo, and the vision of a bear came to her because there's bears all across Turtle Island, yeah, it's quite beautiful. So thank you. Okay, next slide, please. Okay, one of the projects that we worked on under Strong Bear Women's Journey was long-term sharing circles in Ontario and Saskatchewan. The sharing circles I held in Northwestern Ontario ultimately informed and shaped the drum making retreats that we'll be presenting on today. In my experience, many existing projects claimed to include an Aboriginal approach to finding solutions where in fact they were just kind of done in a colonial way. The inclusion of a medicine wheel, a few feathers on a poster, a few choice words used to make these projects seem to be done in a good way, when in fact they had just been what is called beaten feathered. This concept is commonly referred to as cultural flavoring, and was far from what the community needed. For sharing circles held from 2014 to 2017, elders and leaders were involved throughout the planning and delivery process. The topics in the sharing circles were never predetermined. 16 women joined the group. Sometimes only 4 would show up, but sometimes all 16. Initially, we were serving dinner and then having the group. We realized that this was a big thing. Food security is super important in my region anyway. Conversations were initiated around key points, including racism, stigma, mothering, grandmothering, gender identity, and sexuality. Some other topics were sexism, loss of culture in urban center, transferable skills, navigating systems, and stress management. Sometimes some of the women who were participating volunteered, and they felt very empowered by taking on leadership roles in the sharing circle. And there was a lot of sharing between HIV positive and HIV negative women. Knowledge transfer was a key outcome of this project, and several women were not familiar with smudging, as they've been refused in the past just because of judgment in the community, and some of the women were using substances and were told that they weren't able to participate in that. The sharing circle helped fill this gap in cultural knowledge, and many found it powerful and beneficial. Some of the challenges that we experienced, early discrimination led to elder many having a conversation about inclusion, stating that we were all women. We had a trans woman join our group, and there was some discrimination there. It was important to address the history of Indigenous people and the role of lateral violence in creating friction within the group. And we strive to create an open space, and Mandy was always available to the women afterwards. There were many conversations about loss. And in terms of logistics, there was friction between two spheres, the institutions of funding and the requirements and needs and the delivery style of organizations. We learned to work together and develop budgets, protocols, and address the challenges posed by the institutional world. I also want to note that throughout this 2-year-plus process, I was working as a research coordinator on other research teams, and different women in the community were involved and talking amongst each other about the projects that I was involved in. I'll talk more about that in a few moments, but I just wanted to acknowledge that my connections to community was being built on from multiple projects, and that helped with the success of this one. Next slide, please.
Thanks, Jasmin. So as Jasmin has already shared, much of what was coming up in the sharing circles reflected things that have largely been dismissed by those who haven't experienced them. Indigenous women living with HIV occupy a social positioning that's affected by factors such as colonization, racism, and HIV stigma, as well as the additional responsibilities associated with womanhood, such as caregiving. These factors coincide with social and institutional barriers that impact access to healthcare and well-being. Within the Indigenous community in Canada, women continue to bear a disproportionate share of HIV acquisition rates. At the same time, Indigenous women are underrepresented in HIV research, programming, and care considerations. These gaps continue to impede the development of culturally relevant approaches to address the HIV epidemic among this community. There's a specific need for research involving Indigenous women that goes beyond biomedical and epidemiologic research, and instead invests in addressing social and economic factors that influence the lives of Indigenous women living with or affected by HIV. I think it's important to note here that these fireside chats have demonstrated that there has been an important recent shift in focusing on Indigenous women living with HIV, and we really hope that all of this work continues. So for this study, following the lead of the women in the sharing circles, our team, led by Jasmin, used community-based research methods to explore the healthcare needs of Indigenous women living with HIV in a small Northwestern Ontario location, and to listen to the experiences of Indigenous women living with HIV to offer recommendations for delivering appropriate healthcare. Over the past 2 decades, there have been successful efforts to begin to incorporate Indigenous knowledge systems into the research process. Indigenist methods emphasize relationships with other people, land, and spirit, rather than detached objectivity. Validity in this work is centered on responsibility to individuals with whom one has a relationship, rather than on applicability across various groups and contexts. Indigenous methods emphasize that knowledge is gained through self-reflection, relationship, and engagement with stories. In this project, we centered storytelling, ceremony, and relational accountability. Our work was based in relationships, Jasmin's with the participants, the women with each other, and our interconnected relationships with knowledge and ceremony. To enact this methodology, Jasmin's relationship with the participants allowed her to consult with them about their desired activities. Our intent was to have a retreat where the women could come together and be taught how to make drums from an Indigenous knowledge keeper, experience Indigenous ceremonies led by Elder Linda and our drum maker, Sharp Doppler, and have time to reflect on their life experiences and healthcare journeys. We originally intended for the women to take time to add art to their drums to symbolize their healthcare journeys, but as we came to learn throughout each step of this process, responding to real people and relationships must always take priority over our research plans. For our analysis, we used the sharing circle data. We also went back to the women in 2018 after we completed our analysis, and we presented the data back to them over lunch. This lunch and learn type event gave us the chance to re-engage the women involved, be accountable to what we wanted to share about our learnings from them, and to remind them that they had control over what happened next with their information.
Through our sharing circles with the women, we learned so much about their healthcare journeys. One of the main themes that we heard in our retreat was the idea of being connected. We heard them say that they felt the best when they were connected to other people, to their families, to the broader community, and to their culture. Some of the women spoke about the importance of group healthcare, and some of the participants actually used our retreat as an example of taking care of each other and feeling better. Remember, though, that our retreat was combined relationships that they had already been building, along with a cultural ceremony, nature, meals, and more. One of the participants shared, "Yeah, I just feel really healthy being here." And another shared, "It's goals here," which is a different thing to say, but what I think is that she felt like she could meet her goals. There are several moments where people share that they felt healthy or well when they were with others, when they can talk to each other about what's happening in their lives, and when they can seek advice. Some of them talked about how this is already being accomplished by participating in group research projects, and others talked about how they feel better when they meet people in their volunteer positions. One participant shared, "Before I ever came to these kind of events, I felt alone and completely ostracized. But since I've been coming and joining in on these, I can't believe how much better I feel. These groups make you feel. I thought I was the only one at the emergency room and doctors. It didn't appear to me that there were so many people experiencing this."
Relatedly, family was brought up as very important to consider. Some of the women had family members who were already supportive in their healthcare journeys and critical to their health. One participant, for example, shared about trying to seek help from the emergency room for a manic episode she was experiencing. Her care needs were not taken seriously and she ended up leaving. She shared, "Well, I got better on my own with the help of my brother because he goes through the manic periods too. So yeah, and the facilitator asked, "How did he help you?" And she shared, "Well, being there to listen to me. When you go manic, you're talking 100 miles a minute, and he was there to listen. Then I just went through it, but then maybe a month of that, yeah, because he knows what it's like. He went through it." For this participant, her family helped her get through a tough time. For other participants, they wanted to be more connected to their families. Participants talked about how they felt it would be good to have more support in disclosing and explaining HIV to partners and to families. One woman noted that younger relatives may receive education in schools or from groups, but people who are no longer in the school system may not be educated about HIV, and this might make it harder to disclose or share about HIV to family members because of the stigma that still exists. One participant asked, "How am I able to get through to them that what I have is not hurtful? How am I able to communicate with my family?" Jasmin, you're muted.
I apologize, I'm muted. I'm going to start again. Okay. Broader communities were brought up as either beneficial or hurtful, depending on HIV stigma. Some of the women had experienced isolation from some of their communities, which was talked about negatively. Others had found a new connection with different communities, such as through volunteer positions, and this seemed to be positive. In one sharing circle, a participant reflected on our time together. Before I can talk about what they shared, though, I'd like perhaps to briefly share a few of unforeseen events that shaped our retreat. On our final day of the retreat, we woke up to a blizzard and lost hydro at the retreat center, which is a problem because all of the heat and appliances were electric, and there wasn't a generator on site. We had to leave the retreat center, and the roads were so bad that we actually had to push one of the vehicles up the hill. Our participants actually had to help us do this. One of the participants shared later, "This is how it seemed like all of us pushed the car up the hill. Yeah, that's a good." And the facilitator, myself, said, "That's group healthcare?" And the participant responded, "Yeah, mentally, physically, spiritually." And another participant chimed in, "That's community." So, okay. Thank you. I'm so sorry, everybody. I have the flu so bad and I'm trying so hard.
You're doing great, Jasmin. So several of the women also spoke about how being connected to culture and traditional resources could be one way to be well. Drum making was emotional for some. It was a real accomplishment. So one participant said, "I always thought that drum making was just slap it together and that's it. Here and there, as long as it sticks together kind of thing. I had no idea there was an actual, making this thing was kind of, it was good that I actually felt pretty accomplished. I'm still staring at it like I did that." At the end of the retreat, in our last sharing circle, several participants spontaneously shared who they were thinking of when they made the drum, and a few shared that they wanted to share this experience with others by gifting the drum to someone. Specifically with respect to health and healthcare, a few participants also talked about how they would like to learn more about traditional practices, such as medicines, and how to use plants in ceremony for healing.
A few topics related to institutionalized healthcare really stood out for us. The first was in regards to emergency rooms. Emergency rooms were discussed as a place that was sought out only in the worst circumstances. And many of the women shared that they had gone to the emergency rooms in the past and been treated with disrespect. They were isolated, ignored, or accused of being there for drugs. Many of them discussed being in incredible pain or distress before finally going to an emergency room. And once there, some discussed how their actual needs were not prioritized. The women had found ways on their own to overcome barriers in these spaces, some by bringing their own medications with them, some by bringing family to support them, and some simply left when they were disrespected. It appears to us that one local organization was useful and stigma-free, and this seemed very helpful to them. Lastly, we heard some of the women talk about the desire for alternative forms of care, such as massage therapists, and as mentioned before, traditional Indigenous care and medicines.
In thinking about the problems in healthcare, we were led right back to the beginning, to this idea that not all care needs to or should come from a medical doctor or medication. Connecting to other people can be helpful. The current medical system of doctors simply treating patients is not working. There are barriers for people, specifically Indigenous women living with HIV, in accessing healthcare services, in part due to the intersecting stigmas mentioned earlier. This tells us that in these institutionalized care models, at the very least, more effort needs to go into breaking down assumptions about people and ensuring that healthcare providers are talking to people based on what they actually share, not what is being presumed. More importantly, though, there needs to be changes in what it means to receive healthcare. Healthcare is not necessarily access to a hospital. It's access to other people, to culture, to knowledge. In our current climate with COVID-19 physical distancing, some of the main forms of care that our participants were actually talking about may not be as accessible as they were before. And even before, it wasn't as accessible as it needed to be for everyone. Before we conclude, we want to each share a key learning about what we're taking away from this experience, and we would like to invite you to connect with us after and continue this conversation. So I'll hand it over to Jasmin and then to Elder Linda before I share my own.
Okay, well, in difficult times, I'm making this work and I'm actually calling Linda, so just bear with me for a quick second so that she can.
Hi, can you hear me?
Oh my God, there you are. Okay, good.
I know, I finally figured it out. There's a secret little button on the right-hand side.
Is that the one with the microphone, my friend?
No, actually, I had to find it. I see the microphone, and I was really pressing really hard on it. But
Well, Linda, maybe you'd like to start by sharing some of your reflections from all of this.
I just heard this last second here. I just did it just now.
Okay. Oh, that's fine. So Linda, what would out of the retreat, what do you think some of the take-home messages, or how would you summarize the experience, or some advice that we received from the women?
Oh my gosh, that was like so much. They said so much and did so much and felt so much, and yeah, the one of the most things I got from it was the thought at the beginning when they first started on this journey, that first days, that they thought it was a life sentence, that it wasn't going to go anywhere, that they were their feelings of being alone. That was the main thing, was that they were on this journey on their own, and that they were the only ones that had this. But when everybody got together, it was different. Like at the end, they knew they weren't alone. They knew that there was backup. You know, they weren't walking by themselves. There's a woman walking in front of them, women walking beside them on both sides, and women walking behind them, and walking on the footsteps of other women that had went through this and that are going through this, going through their life journey. That's what got to me the most, was that knowing that they're not alone, that the things that are gonna be coming towards them are on their journey that other women had gone through, and told their experiences on their life journey. Like there was one that was just starting her life journey, and there was another one that is maturely on her journey, and they sat together and they talked. And I cried. It was a beautiful moment. Yeah.
Make which, Linda?
I just start crying all the time.
For me, I really saw it about reciprocity. It seemed, well, and it's quite evident even just for myself being in the research assistant role of this, that my health and their health all kind of is connected to helping one another, and these women absolutely were helpers. If you know, Angela and I pushing, you know, because we're the ones with the lease on the vehicle, and we were the ones pushing or trying to drive vehicles up a hill, and it wasn't like, oh, what do we need to do? All these women jumped out of the car and just started pushing it up, and they were taking care of us, and I got some hives when I was there, and you know, there were women that went out and picked some cedar and told me to put it on my face to make it better, and everybody seems to do better when they're not just in the passive recipient role. So it's about reciprocity. It's the ability to give and receive help and love and care and community that seems to keep people well.
Yeah, thank you both for sharing those things. I mean, what you have said also really connects to what I wanted to share as well. And that was, you know, the most meaningful thing for me was how powerful this whole event was and how transformative it seemed to be even before our eyes in 3 short days. And it just struck me that things seem to be so different in this retreat than other research experiences I've had. And I think it was in part because of all of the care that was taken beforehand and actually involving the participants and designing the entire process. And they all felt like this was their event. It was planned for them. They got to have input into it, and they were a part of the entire thing in terms of not just participating, but like really being partners in the whole process.
Shortly after the retreat, one of our participants suddenly passed away, and the death, you know, death is just part of life, I guess, but it's really sad, and yeah. So I just wanted to take a few moments to acknowledge her. Or just big wedge. Okay, research was a new thing to Northwestern Ontario at the time, especially with Indigenous women, particularly research that was inclusive of and welcomed by the community. I want to acknowledge, and we want to acknowledge, that without Visioning Health 2 and the Chibos Project, to name a few, this work may have not been welcomed or engaged at such a deep level by the participants. Sometimes, you know, we hear about, oh, there's too many projects going on, and I don't really think that's the case here. I think it was actually trust building and and really good for the community. This research paved the way for this work, and we're grateful for all their contributions in the community that continue on today.
And we would, of course, also like to thank our funders, CIHR, and the Innovation Fund of the Alternative Funding Plan for the Academic Health Sciences Centre of Ontario. So as we open up to questions and discussions, we really hope that whoever is on the call right now will continue this conversation with us. And we've just put these final thoughts up on the screen as potentially a starting point or just reminders about some of the key things that we found in this study. And once the questions are over, we will also welcome Elder Linda to formally close the meeting for us as well. So we'll open it up if anybody wants to use the chat function or jump in, please feel free.
You want to read out your final thoughts?
Sure, yeah. So some of the final thoughts that we had come up with. The first one is institutionalized care is a last resort due to discrimination, and this can be situated within Canada's history of colonization and racism. And so what we were proposing is that addressing problems in institutionalized care is definitely needed, but it's not enough. There needs to be more done. And we need to reimagine what healthcare actually looks like or care looks like. So from these participants, connection to family, community, and culture were critical. And women the women in this retreat seem to be using research as a way to connect. And so we were wondering how more sustainable solutions can be created and maintained.
Are you asking us a question?
Yeah. Yeah.
Oh, I see. Isn't that why we're doing research, is that we can have a place like this without the research being done, and so that we can, that so that the government hears us, that we need a place, that has been taken away from us for the past few years now. And I think we need to get the policy makers to listen to us and say, yeah, we need this. This is what happens when we get together. All these good things happen, and we are supporting each other's.
Mm-hmm. I know the organization that I'm working at now, Elevate NWO, and I work there with Linda, was able to take some of these recommendations and implement them. They've created a women's healthcare group pre-COVID. There's been lots of gatherings, and probably most importantly though, Holly Govan, the executive director, went after direct funding to have a position so that Elder Linda Barkman is available to facilitate programming and groups and create meaningful connections, and to just be an elder at the office. It's pretty beautiful. Maybe Linda, you want to talk to your position a bit?
Sure. Just like today, for example, we have the food bank today. So I'll come in the morning and I'll smudge the Elevate here, and then sometimes I'll go outside and smudge. It all depends whether or not the people outside, when they come in for their food banks, would want smudging, or there's a few of them that can't smudge inside the house or in their apartment building, so I'll make them liquid smudge where they can bathe themselves or spray it around if they need to be. I have a room, an office, and an Indigenous room where we come in and we'll sit and talk and smudge. I do crafts with them, so that way, like this week, next week, I'm gonna be starting making mittens. So I'm getting leather jackets and all that stuff, and we're gonna make mittens that we sew by hand. And while we're doing that, we sit and talk about whatever they need to talk about to get stuff off their chest, or just to come and have a cup of coffee and yeah, socialize. But they'll leave with something. It's whatever they make, whether it be a dream catcher. Like I said, we're going to be making I'm going to be making gloves, mittens next week. So yeah, like I said, we'll do that, and then we'll sit and have coffee, and we'll talk about whatever they need, whether or not they want to talk about the grandfather teachings, or they'll come in, and some are going through detox, or going through another organization up here is Crossroads. They'll come over and they'll talk about what their struggles are, and what the struggles are for that day, or what struggles they need to overcome. So I sit here and I'll listen, and then we'll smudge. I'll give them maybe a little, like I said, coffee, or yeah, but I make sure that they don't leave here. They'll leave here with something. Yeah.
Linda, do
Sorry.
you think that it helps people engage in seeking medical care?
Yeah, because there was quite a few of them don't like taking pills, don't like taking their medication. Some of them can't like do the swallowing thing. So I talk through them about their meds. I don't, yeah, we talk about the meds. That's one of the main topics sometimes, but yeah. Did I answer that question?
You said whatever you said, and it was important, so yes.
Yeah.
Yeah, I have another question, Linda. Is there somebody there that can go with them on their appointments, so that they have the support that they need when they go, or to the emergency? You know, I heard that they were having trouble with stigma and discrimination. I'm just wondering about how we're going to go about challenging that stigma and discrimination they face when they go to get their medical treatments.
Jasmin actually would be the one that would could answer that.
I know within our organization, we've had some people that have been treated pretty badly, especially during COVID-19. So we went through the hospital's mandate and all of their rules and regulations. And one of the ways that you can go into a hospital as an advocate or a support person is if there's a communication barrier. So with our members who are Indigenous women or Indigenous men, or actually any of our members, really, I will go in as somebody that goes in with it and indicate that there's a communication barrier. The communication barrier, though, isn't with our people; it's actually with the doctors. But that's kind of, I'm using their own words against them. So we've been going in. Yeah, we've had people left here at the hospital who, yeah, it's not great. So we're doing the best we can. We do have a clinic on site, but we have a lot of stuff going on in Thunder Bay right now. So that's how we're managing that. I hope that answered your question.
I think that's so genius to talk
Thank
about
you.
communication barriers. I'm just noticing, Margaret Robinson, you had a question about what tips do we have for speeding institutions to pay and reimburse people? So I'll let Jasmin speak to this too, because I know Jasmin has some thoughts on that. No, maybe Jasmin will speak on this as well. But one thing that we didn't mention is that we did pay participants $200 each for the 3-day retreat, along with if they had children, we paid them $105 for childcare. And then for the member checking lunch, we paid them another $40. And we've had some really positive experiences with our institution, which would be Women's College Research Institute, and we've had some challenges as well. Most recently, we've had a lot of meetings with our finance department and the folks who run that, and talked to them about the need to have funds given to us upfront so that we can pay cash at these events. And the most recent team that's in there has agreed to do this. And so we basically get like a time limited petty cash that they know exactly what it's for. And as soon as the event's over, within 2 business days, we return the receipts and whatever is left over to them. And they've been really supportive of that process. And I know that that's not going to be the same for everybody or everywhere, but just having those conversations. And I think, there's been a lot of work at Women's College about having those conversations from different teams and for different projects. And so I think just being the bug in the ear and trying to push those things forward can sometimes be helpful. I don't know if anybody else wants to add to that. I know that there's a lot of researchers on this call, so if anybody else has suggestions for that, please feel free to jump in.
It's Mona. I'll make a comment, but not related to the reimbursement, but I was involved with analyzing the transcripts with Jasmin and Angela, and one other researcher. What's her name again from in Guelph?
Andrea Breen.
Andrea, right? Yeah. And I do have to say that reading these transcripts and doing the analysis all together actually was really eye-opening for me, and changed the way I thought of practicing healthcare, as a clinician. So because trained as a clinician in Western medicine, after reading the transcripts, I got the feeling that the women that were at the retreat wanted or needed an Indigenous way of healthcare, which involved family, community, connecting, culture, and really the vision of the square and the circle, like the square hole and the circle not fitting together, and that there was such a disconnect between the Western medicine that we offer and the health care and the care that these women wanted, and it just made me totally realize how Western medicine is so institutionalized and is a real colonizing area and experience, and that I'm not sure if it works for Indigenous women at all, and I think it's it's problematic, and yeah, it really changed the way I thought about health, about care, and I didn't really come up with a solution, other than that it was a really big realization for me. Not sure if anybody wants to like expand on that thought, or?
I think it's just really important, and I mean, I know that you do this in your practice, is to ask, you know, people how they're doing on all levels, and to be able to offer to support that as well, and you know, and hear that one is not more important than the other, that they're all equally important of what somebody has going on. And I'm sure you know and do that, so that's why you're here. And
Hi.
I got this funded and did all those great things.
I would just like to make a comment on the project. I think it's a beautiful project, and I think it's very necessary when it comes to applying that into women's lives. I'm part of a research project here in Regina, Saskatchewan, and we are working with the Quote-Away Program project, which recruited 7 women living with HIV or affected by HIV, and they are called our Willow Warriors, and we're going into our 2nd year, but again, at the beginning of February, we had a drum making session as well with Elder Betty McKenna, who gave us a 4-day teaching. And so with that, the women were able to understand where those teachings came from, and was able to make their own drum. And I guess from that time to now, the women have I've really seen a change as they built a relationship and kind of regained their responsibility as drum carriers. And I feel that cultural intervention practices and bringing back those responsibilities to Indigenous women really help with how they apply it to their lifestyle. And with that being said, a lot of them have let down their walls, because when we came together, they had their walls up, and there wasn't room to make friends, and there wasn't, you know, they were just really aware of who they were surrounding themselves by. And today I can say that that group of women is a sisterhood, and today they come together to ceremony with their drums, and they sing songs. So things like that, I think, are really important to building up their self-esteem and building up that love for themselves, their family, and their community. And I feel that it also makes how they approach that healthcare system, they kind of address it in a better way, not as aggressive as they used to. And I don't blame them for that, for probably the experiences from the past. But I believe that cultural intervention practices for projects like these really help the women rehabilitate themselves and to stand up to the world. Thank you.
Thank you for sharing that. It sounds like an amazing project out there, and I hope that you join one of these fireside chats if you haven't already, and I would love to hear more about it.
Actually, yes, I'll be presenting with Carolyn Pelche in May of 2021 for the Digging Deep. So a couple more months, but looking forward to it.
Fantastic. I can't wait.
But one of my questions is, like, these events are so amazing, and what I've seen is really like the care that's needed and is the medicine that's needed. But we do them so often now under research projects, and like, how do we get them from being research projects into sustained projects in the community that go on? Like, Jasmin, you reviewed how that's been done in Thunder Bay, but it's being done, you know, everywhere, so that there's sustainability. Because I think, like, from what I said before, what I've seen is, like, really that's what the women want in terms of healthcare, is the connection and the cultural experiences.
I have a comment on that. I mean, I think that I think me, you know, leaving a research positions to go work frontline, you know, it has had not that you know, it wouldn't have happened without, but you know, it's been influential. And one of the things that I noticed when grants are written, or you know, timelines are written, that there actually isn't, you know, we'll talk about KTE, but we don't actually talk about you know, funding or support to actually implement into these programs, like these programs into the organizations or the community partners that they've started with. It's like, oh, it's finished and the funding has ended, and this is how you can do it. But there actually hasn't been, there usually isn't anything written into grants on how to build sustainability should the intervention or project, or however it's framed, was successful and did have benefit. Yeah, it's just it's a little, it's a little flip, but it's something that perhaps when people are applying or are doing their work plan, the famous work plan, is to actually make sure that that's put into it, and that the proper amount of time is put there, and the commitment to the organization happens as well. I mean, things come and go, and it's and I've said this publicly before, that it's really actually quite sad that these types of programs have to happen solely through research. I think that organizations don't have the funding to do this. I mean, if you even look at buying a drum kit, for one person to make it, it's about $160. Is that correct, Ange?
Yeah, per person.
Yeah, it's $160, and all of the other stuff that went into it. But I would say, and that's absolutely fantastic. But frontline organizations aren't funded to do this kind of stuff. They're funded to make sure people get their blood work done, and to make sure that they pick up their medication, and that there's a food bank available. So maybe sitting with the organization and finding a way to apply for these through charities or whatever it is, but just to make sure that it continues on.
I was just gonna say is that when one of the things that we had done was a box. One of the girls that made a box, it was just a small little tiny little box, and she painted it brown, and we're all looking at it, and she says, "This is me." She says, "This box is me." She says, "At the beginning, there's nothing in there." But then she opened it up this time, and inside was a little flame that she had made paper, red paper, and she made a little fire inside that little box. And she says, "With everything that I know now," she says, I was alone at first. That box, I didn't have no education, no knowing what was going to happen. But now that she knows what's going to be going on with her life, she said that now she has a flame inside that box, and that flame is her. That's inside of her. And she says, as long as I keep doing what I keep doing, she says, my flame will keep burning. And that's taking care of herself, doing what she needs to do, going to all her supports, going inside herself for her support, and reaching out. And that's what she's been doing, and she says her flame is still burning. But yeah, to keep this going for a long run instead of just having it as a research, I don't think I know that the ladies or anybody that's going through this journey would find it a lot lighter, where their well-being will be well-being. Yeah.
I think that might have wrapped up the questions and comments. Thank you all so much for coming. Elder Linda, may I please ask you to do a closing? Oh, you're on mute.
Just when I put a candy in my mouth. That's good. Okay. Oh, miigwech. We had a lot of good conversation. We know what we need. We know what our people need. By meaning our people is everybody that's around us. And yeah, miigwech creator for everybody. Miigwech for the beautiful day. And miigwech. Miigwech.